Hey listeners, looking for a morbid podcast to fill your deadly desires?
I'm Mackenzie.
And I'm Olivia,
the host of Death by Champagne, the podcast here to keep you up at night.
Each week we have a booze-fueled conversation about scary murders, haunted houses, cold cases, tales of the occult, and anything else that's spooky and deadly.
Find Death by Champagne on your favorite podcast app and subscribe to hear about stories like the demise of the Lemp family, an insane episode on kidnappings, the Beckford hauntings, an episode dedicated to crimes in Australia, and others like Ouija boards, vampires, and cold cases from the Midwest.
We release new episodes every Friday, so tune in, get your sage ready, bring your cat keychain, surround yourself in a salt circle, and camp out under the covers.
See you then!
Throughout history, in the name of medical advancements, many barbaric experiments and practices have been undertaken by scientists and doctors. Many of these left patients in a worse state than they were to begin with, and oftentimes these patients lost their lives altogether. What sounds like a terrifying horror movie is actually the history of medicine. You're listening to Creep It Real, and today we're discussing cruel and bizarre medical practices that will make you question if you ever want to go to the doctor again.
Well, hello everybody.
Hello.
It's Ashley.
And Shy.
And Creep It Real is who we are. It's been a while.
It has.
It really has. It's been a while since you were up on here, so here we are.
Yeah. Hi.
Yeah. She's back. So today we're kind of going like I was trying to think about it this morning. Did you come up with this topic before we started doing MK Ultra or after we started doing MK Ultra?
I can't remember.
Neither can I. So regardless, in my opinion, I feel like it may have stemmed from
MK Ultra.
MK Ultra research in that we are covering kind of the cruel and bizarre and unusual medical treatments and procedures of history and today. So it's kind of a interesting topic for us to cover. Kind of a little different than usual, I would say.
Still creepy.
Yeah, for sure.
In nature.
It was giving me so many heebie-jeebies whenever I was reading some of this stuff. I was like, is this real life? I mean, how many times do I have to say that?
Oh, it totally is, though.
Absolutely. It's crazy. So here we are. Why don't we just get started? I mean,
yeah.
I was just going to start with saying that modern medicine is thought to have been invented by Hippocrates between 460 and 370 BCE. I'm sure we've all heard the Hippocratic Oath that doctors take whenever they sign up to be a doctor.
Get sworn in or something. Yeah.
Which, after all the reading we've done, this Hippocratic Oath is bullshit. Like, who cares?
Yeah.
We're doing all sorts of stuff in the name of science. Okay, but anyway. So, he had begun to categorize illnesses as acute, chronic, endemic, epidemic, and used terms such as exacerbation, relapse, resolution, crisis, and a couple others in convalescence. So, he kind of invented some of these terms that are still obviously used in medicine today.
Right.
Medicine continued to evolve as time went on, much of it having to do with good old trial and error as far as experimentation and research is concerned. I mean, at some point, in order to develop certain techniques and procedures, you did have to start in a kind of crude way, I would say, probably.
Yeah.
But gosh dang, some of this stuff is just, I don't know if this is really forgivable here.
Well, and back then, you got to think, too, the conditions probably were not that sanitary.
Mm-hmm.
There was no form of anesthesia in this day, in like Galileo's day, right? Is that who you said? No, Hippocrates and Galen, right? Okay. So if you were to perform an experiment on a person and they were alive, I don't even...
Bite down on a strap of leather and buckle yourself in for it.
Yeah.
Terrible, yeah. I mean, and honestly, though, as we'll see as we read on today, that kind of happened to people even into the 20th century, unfortunately, or late 19th century.
Oh, yeah.
There are supposedly 7 requirements that make up a framework for ethical research and the ethics of clinical research studies. Now, this is in present day the medical community. I don't think it's official, but well-known requirements that determine whether research on people is ethical or not. So there's value. Are the advancements of health or knowledge derived from the research? Scientific validity. The research must be methodologically rigorous. The 3rd requirement is fair subject selection. The scientific objectives, not vulnerability or privilege, and the potential for and distribution of risks and benefits should determine communities selected as study sites and the inclusion criteria for individual subjects, which that's a wordy way of saying that, it shouldn't just be like poor, disadvantaged people who are study subjects. But as we have seen and we'll talk about today, that's generally who gets studied on, is the disadvantaged, poor, even though this is part of like the framework that supposedly they're supposed to go by.
Right.
Number 4 is a favorable risk-benefit ratio. Within the context of standard clinical practice and the research protocol, risks must be minimized, potential benefits enhanced, and the potential benefits to individuals and knowledge gained for society must outweigh the risks, which is very subjective, I would say. Number 5 is independent review. Unaffiliated individuals must review the research and approve, amend, or terminate it. Number 6 is informed consent. Individuals should be informed about the research and provide their voluntary consent, which we know doesn't happen all the time when the government's involved. And number 7, the last one, is respect for enrolled subjects. Subjects should have their privacy protected, the opportunity to withdraw, and their well-being monitored. And fulfilling all 7 requirements is necessary and sufficient to make clinical research ethical. Which, okay, so obviously we have just covered tons of things that have happened, and we're going to today where that's definitely not been the case at all whatsoever.
Well, I don't think humans are the greatest at identifying what is ethical and what is not.
Well,
we have a history of shrooting that up.
Shrooting. So I would say, I think to a scientist's mind, like I said this the other day to somebody, well, it was probably Peter, that you will do whatever you need to do in order to gather the data or find a solution to a problem, or to get just in the end result whatever you want out of something.
I get what you're saying.
Yeah. So, I have just a hodgepodge of Let's just start with kind of like a ridiculous one. This is just a medicine that was given to babies, which was so they developed this thing and they called it soothing syrup for babies. So it was to aid the stressed 19th century mother. They were either powders or lozenges or syrups that were created. It was essentially a fun brand of like baby's first narcotics.
Wasn't it similar to heroin?
It had heroin in it. So they were created to be completely safe for the most vulnerable members of every household. One of the brands was Miss Winslow's soothing syrup, and it contained 65 milligrams of pure morphine per ounce.
God.
And the concoction was used for babies who were either crying just for whatever reason, teething, had dysentery, which the opioid effect of the syrup caused constipation, and that would help treat the diarrhea. But, that's a severe treatment for the runs.
I know. Let's just go the opposite way with it. Let's just stop it from happening altogether.
Just plug them up. So the syrup contained, like I said, 65 milligrams per ounce, as well as alcohol. So 1 teaspoonful, just a teaspoonful, had the morphine content equivalent of 20 drops of laudanum, which is an opium tincture. I know that laudanum used to be able to drop it in your drinks, and it was essentially just, it's opium.
Yeah. So it was definitely a relaxer, because if you've ever seen someone on heroin, they kind of just melt away and have a hard time staying awake.
Yes. So it was recommended that babies 6 months old receive no more than 2 to 3 drops of laudanum, but they were taking 1 teaspoonful of the soothing syrup. It contained enough morphine to kill the average child Many babies went to sleep after taking the medicine and never woke up again, leading to the syrup's nickname, rightly so, the baby killer.
Well, duh.
Yeah. How crazy is this? So Mrs. Winslow's soothing syrup was hugely popular. And then in a 1868 court summary, someone reported that they were selling more than 1.5 million bottles of the syrup annually, which is a lot.
Yeah.
Because many caregivers did not link the death of the kids to the syrup for some reason. I don't know how. I mean,
so
was it just...
These parents just weren't into soothing the baby themselves. They just wanted to get rid of whatever was ailing their child. Not even getting rid of what was ailing them, but just wanted them to shut up.
Yeah, just fall asleep. But okay. How can you not link the death to something like this? So anyway, they so because many caregivers did not link the death to the syrup, which is bizarre, or they may not have revealed using the syrup to begin with. There is no official statistic of the number of children that died, though estimates put the number at thousands of children who died from overdose or from addiction and withdrawal after they stopped taking it because they were just plowing these kids.
That's awful, too. That's gotta be so painful.
Yeah. Finally, in 1910, the New York Times decided that the whole narcotic babysitter concept was probably bad in the long run, and they ran an article that was pointing out that these soothing syrups contained morphine sulfate, chloroform, morphine hydrochloride, codeine, heroin, powdered opium, and then the last and least offensive, cannabis indica. So every drug known to man.
This is a SoundCloud rapper's dream drug.
This is like, yes, this is the kind of syrup that everybody's looking for.
Wow,
so, and like, so it contained all of these things, oftentimes in combination with each other, obviously. So that's the craziest stuff I've heard in a while. I was like, are you kidding me right now? I mean, that is every every SoundCloud rapper's dream right there. Or lots of other people, honestly. There are people all over the place that want some
that would just
syrup.
Love to get their hands on some of this.
Yeah, like they'd be. What's the guy from Fear and Loathing's name? Hunter S. Thompson, all over the place. Just like that scene where they're like, I don't know if you've seen it, but where they're trying to get on that that turning bar.
Oh yeah. And it's impossible.
He's like reaching his leg out so far. Anyway, that's what I imagine that these poor... I mean, can you even... I remember one time my mom gave me codeine cough syrup.
Oh, man.
It was before it was illegal, I think.
Yeah.
Put it in. And I was high as a kite. I was laying on my bed just like, woo! I remember I thought I was at the beach. And,
oh, my God.
I mean, it was horrible as well. You know, it was like oppressive. And I was just... It was terrible.
Did your cough go away?
It might have. I mean, I think I went away to a whole other universe at that point. Like, I visited another dimension that day. And,
nice.
And I honestly, to be frank with you, I hate codeine or any those types of pills. Like, they make me so ill.
Yeah.
I get so nauseous by it. So I probably was also just ill.
I know. I've had to take codeine cough syrup too, and I don't like how it makes you feel like you're moving through molasses or just feel weird.
Shout out Bumbles.
Yeah. You're your own molasses flood. I don't know.
That's a good description. Yeah.
I hate it.
There's nothing good about it. I mean, in my opinion,
well, let's just look at Lil Wayne. He used to be so you could understand what he was saying, and now he just what?
Oh, it sucks because I like some of this is like we were really side noting, but I really do. I like some of the Carter 5, but I had so much hope for it. I was really hoping it was going to be the Carter 3 in 2019, but and it wasn't because I said this the other day at the gym, but I'm going to say it again because I will shout this from the rooftops till I die. But the Carter 3 is like one of my all time.
So good.
I could listen to that thing nonstop for the rest of my life, and I probably would be okay with it. And this is just not the same. I know it's just... I've talked to a few people who are like, it's like an evolution of... And I'm like, I guess. He's also just fucked up.
All the time?
Yeah.
Like, there has to be some sort of significant brain damage going on.
He just lost his luster, you know?
Yeah, he has.
Oh, poor little guy. I still love him, but, he's definitely lost. It's probably just hard to be that it's hard to be that wealthy, that adored, and just being able to do essentially what you want, but you still have lifelong trauma inside of you that you're not dealing with. So you're just like, I'm just gonna drink myself into oblivion,
get high,
and party it up. I see the appeal. I do, but still, it's like I said this to somebody the other day. I keep saying that, but in order for like a musician, no matter what kind, in order for them, I feel, to be really powerful, they have to be struggling in life. Like they can't be happy. They can't have like a happy relationship. They need to be going through some stuff and dealing with it, not just getting high.
I also feel like once they've reached a point to where they create a not a split personality, but
a persona.
Yeah, like, Mariah Carey has Mimi, and Beyonce has Sasha Fierce, and Lil Wayne has Tunchi,
like alter ego,
or whatever.
An alter ego.
Yeah, alter ego. I wouldn't say, I guess you could say, but that like Eminem, Marshall Mathers, but that was like from the beginning though. Yeah. But that was when he was amazing. Like the Marshall Mathers LP is your Lil Wayne's Carter 3. Yeah. That's my album. Like I could just be with that album forever.
Yeah.
And then the Slim Shady EP.
Oh yeah, I mean I loved all those.
Amazing
back when
too.
In my teens.
But now he's, and I hate to say it, and you can shoot me if you want, but his sober music is just, and I'm not saying please go get back on drugs, and but it's just, it doesn't do it for me.
Where's the pain? I need the pain.
I need the pain and struggle.
You must suffer in order to make millions off of being an artist, I think.
It's true though.
Definitely not to try to make anybody become relapse. we know sobriety is the healthy way to go.
Right.
It's just that, you just suck now. Let's hand the reins over to somebody that, is struggling in life. So anyway, okay, back to the topic at hand.
Back on track.
I guess we could, we're talking pharmacology now. So anyway, okay, so the next one I've got is trepanation, which is the scraping or drilling of holes into the skull.
Right. Which I guess is what Jeffrey Dahmer tried to do.
I guess. I guess he was just trying to be his own little surgeon.
Little doctor.
Yeah. It's the oldest form of surgery known to man, having been performed since the Neolithic times, which is about 12,000 years ago. They're not entirely sure why it was done back then. Some experts believe that it was for the very scientific reason of trying to expel demons from the skull. Because, all they need is a hole to escape out of. Just give them a hole. Some of these ancient skulls show signs of healing, surprisingly showing that some of the people who underwent the trepanation actually survived for years after the procedure.
It's just weird to me because, again, the tools that you have are probably very primitive.
Yeah.
You're not going to be, unless they knock you out or give you some sort of medieval medicine to put you to sleep, which I can't imagine it's been tested and tried, and who knows if you'd wake up from it.
They probably had drugs back then.
Yeah.
I bet they did.
Some sort of, maybe herbs and spices. I don't know. But just the sanitation to me, just, you know what I mean?
Well, yeah, infections. Yeah. I think that's the bad part about exploring that kind of stuff back then,
right,
in the beginnings, is because you definitely died from infection a great deal of the time.
Yeah. Well, and their whole thing was, back in those days too, it was, they weren't aware of mental illness and all that. So of course they blamed things like demons or evil spirits. And there was a lot of very weird ways, and we can get into it later, like how they treated women.
Yes.
I always think it's just some sort of excuse to touch a woman's private parts, but whatever.
I mean, I think I think that it's definitely kind of a tool to invalidate people, but also taking advantage of people who they see as weaker, which is, we'll get into all, obviously, but which is why there was a lot of stuff done to slaves, to black people, to homosexuals and women. So it's definitely not been a great, they don't have a great track record as far as any minorities are concerned. But regardless, so like trepanation, for example, is not a standard procedure, but it is still done today in rare occasions when there's brain trauma and internal bleeding, where a hole
That's different, though.
Well, it's still trepanation, but it doesn't...
Right, but it makes sense.
Yeah. No, this is actually... I mean, this makes sense, yeah. So, but where blood needs to be drained from the brain. It could also be used for subdural hematomas, where there is bleeding between the cover of the brain and the brain itself, and that happens when someone has like a stroke. So otherwise you could die from like a blood clot in the brain and whatnot, so they need to just drill a hole in and get it out. But it's not quite the same as just being like, you know, maybe somebody's a little hyperactive and they're like, I gotta drill a hole in your brain to get that hyperactive demon out of you. It's not quite the same today as it was back then.
No, thank goodness.
Yeah. Another interesting one that I came across was the tobacco smoke enema, which, did you hear about this one? It's pretty scientific stuff here. So I guess
I missed this one.
In the late 1700s, tobacco arrived to England, and along with the idea that literally blowing smoke up someone's ass was a cure for many ailments from headaches to cholera. So they called the doctor the pipe smoker, who was a London medic who used the technique, and he would do so on people who had nearly drowned. So the tobacco smoke enema was thought to warm the person from the inside and stimulate respiration. The Royal Human Society would leave resuscitation kits along with tools to give a tobacco enema at certain points along the river. I guess, I'm like, was that just for anybody? You're like walking around taking a stroll and you see someone has almost drowned and you're just like, let me get this kit ready and I'll blow smoke up your ass to bring you back too. So in a 1970, what?
What was the doctor's true intentions? Who wakes up one day and says, you know what? I am passionate about blowing air into people's buttholes.
Well, the worst part about it is that, as I'll read on, they started using it to treat cholera and stuff. And so they were saying that the practitioner or whoever was performing the tobacco smoke enema, if they accidentally inhaled while they were doing it, then they would actually inhale, bacteria, cholera bacteria, and then, or something, and get it themselves. So I'm like, it was just so it wasn't safe for anybody, really. So a 1746 paper, The Lancet, had what may be the single best news story of all time. It was the story of a woman who had nearly drowned, and she was pretty much dead, and they published the story, and it says, amid much conflicting advice, a passing sailor proffered his pipe and instructed the husband to insert the stem into his wife's rectum, cover the bowl with a piece of perforated paper, and blow hard. Miraculously, the woman revived. So, pretty much just stuck a pipe up her butt and blew in it. And and that's the reason why she survived.
Sure.
Word of the success of the tobacco enema spread, and that's when people began to use them for headaches and cholera, abdominal cramps, and typhoid. In the 1800s, when tobacco smoke was found to damage the lungs and heart, the use of the enema declined, and I had never heard of this until 2 days ago. So I guess they don't do them anymore.
Thank God. Yeah. I don't want that. I think I'd rather take the hole in the head than someone, honestly.
I don't know if I would say that.
Someone making me a human kazoo. I don't want that.
I wonder if could you blow smoke out of your mouth after that? Would it have come out of your butt?
Okay. I don't know.
You couldn't have. I think that's impossible. Okay. It would have to go into your lungs, and then how would it get there? Your butt. I don't think. I
guess you're right.
I don't think you're. I'm just making silly things up because I thought it seemed like it would be a funny visual. But anyway, so what a weird thing to do. So, it's very strange. Okay, what? Sorry.
The one I I have one. And okay. This one, actually, in other countries, I don't want to say specifically third world, but you get the idea.
Yeah. Okay, so third world countries.
Yeah. Okay. So, bloodletting, which, so this was back in Hippocrates and Galen's day too, as well. It started back then, but it actually started with the Sumerians and the Egyptians.
Okay.
It became common practice in classical Greece and Rome. And the reason why they started doing it is because people were diagnosed with too much blood, essentially. And Hippocrates stated that the body was filled with 4 substances, which was yellow bile, black bile, phlegm, and blood. Which is, I mean, he's not wrong.
Yeah.
We're all just kind of like a bunch of meat sacks full of phlegm and blood and poop and pee.
Yeah, and he called those the 4 humors.
Yeah. So essentially, it just like what it describes, they would cut open a main vein, and it was meant to reduce blood volume. But as we know, the side effects of that are pretty detrimental, especially if you're not replenishing your fluids, or they probably didn't have a cookie and a glass of orange juice at the end, so you felt better.
True. It reminded me of that episode of The Office where they're doing the competition for the blood drive, and like who is it that just gets it done so much? Or no, is that Parks and Rec?
No, it's The Office when Michael meets that girl and he finds her glove, and Stanley tries to go get it, but because he wants the cookie.
Yeah.
And he's like, he has a Band-Aid, and he was like, I didn't get my cookie. And she's like, weird, we're not using Band-Aids today. And he's like, oh no.
Anyway, sorry, continue.
So sometimes they would, and this skeeves me out because I hate slimy, creepy, crawly things. Leeches.
Yeah.
Which actually is a pretty common modern medical practice these days for getting rid of old, sick blood in a patient's body, or removing blood and fluids from a newly operated on site on the body, whatnot. So, I mean, it is ancient, but it's still very much in use in a sense that we are using methods of gross leeches. Bloodletting, essentially.
Yeah. We also, nowadays, there's something called a therapeutic phlebotomy. This is where a doctor uses a needle to extract a pint of blood from a patient 1 to 2 times a week for several months or longer.
Golly.
So that the person's level of ferritin, which is a protein that stores in iron levels, decrease to a healthy range. So I guess that's what they do nowadays.
That's a lot of blood.
Yeah. I'm sure whatever they do I'm sure nowadays there's some method that they use to make it not as terrible.
And we have IV fluids now to help restore hydration and
true.
Balances and whatnot. So mercury therapy, which I found interesting because mercury is probably the most toxic thing on the planet, aside from some people's vibes. So mercury is notorious for its toxic properties, of course. We all know that the old thermometers contained mercury, and what was it? I remember my teacher telling me they were just having issues with them breaking open and people touching the mercury and getting sick and whatnot. So it's cool to look at. I mean, everybody's heard of Quicksilver. And so back in the 2nd century, Chinese alchemists prized this liquid mercury for their supposed ability to increase lifespan and vitality. So one of their emperors, I don't even know, Qin Shi Huang, he started taking mercury pills to give him immortality. And supposedly when you ingested it too, it could make you immortal, and it could give you the ability to walk on water. So people were just kind of like sucking it up.
Oh, good.
And at one point in time, it was actually used to treat syphilis, typhoid fever, and some other sicknesses and illnesses. But people started experiencing all these other symptoms, and they weren't correlating them to the mercury ingested. They just thought that their symptoms from the other sickness were getting worse.
Oh, Lord.
So instead of dying from their original ailment, they would die of mercury poisoning.
Cool.
And it was painful. And I think I read that too. It makes your teeth fall out. So
I mean, there's a lot of things that it does to you.
Yeah. your eyes bleed, your teeth fall out, your butthole falls out.
Syphilis is like they are just experimenting with. They have experimented with all sorts of shit to get rid of syphilis, and I'm almost like because is there another? Well,
can you get rid of syphilis?
Well, I don't know.
Is it curable?
I think it is nowadays. I definitely think it is nowadays.
I think chlamydia is pretty common, right? And you can get rid of that.
I don't know. I really don't know.
Okay.
All those good old sexually transmitted diseases. Whoop-de-doo. Well, in a similar vein, arsenic has been used for over 2,400 years as a poison and a therapeutic agent.
It was kind of like a magic elixir at one point. They were putting it in everything.
Yeah, like Hippocrates used arsenic sulfide realgar, I don't even know what that means, to treat ulcers. And then in the 1700s, there was an English inventor named Thomas Fowler who developed a solution of arsenic trioxide and potassium bicarbonate and used it to treat asthma, eczema, psoriasis, anemia, Hodgkin's lymphoma, and leukemia. And then, almost 200 years later, in 1878, the solution was aptly named Fowler's solution, and it was found to lower white blood cell counts in normal individuals, and even more so in a 10-week treatment of individuals with leukemia. So it was widely used as a treatment for leukemia until radiation was discovered in the 20th century. However, in 1931, arsenic trioxide made a brief reappearance after 9 patients with chronic myeloid leukemia responded to the treatment at a Boston City hospital. And while it helped lower white blood cell counts, it reduced the swelling in the liver and the spleen of these people, 5 of the 9 patients suffered arsenic poisoning. And, that's no good. So then radiation and chemotherapy replaced arsenic trioxide, though obviously those also come with their own side effects too. In 1910, Nobel laureate and physician and founder of chemotherapy Paul Ehrlich introduced salvarsan, an organic arsenical, as a treatment for syphilis. That's what I was thinking. There we go. There's another syphilis, which is still used to this day to treat something very much a tongue twister, but it's also called Chagas disease, which is a parasitic disease caused by these things called kissing bugs.
Oh, those are still very much alive today.
Yeah, it's a problem.
In Texas too, right?
Yeah, it's a problem. I mean, I don't know that I've been encountered by any kissing bugs. The problem with it is that you don't really know that you have it necessarily. Sometimes there's symptoms that just go completely unnoticed, or there aren't really any, and then it can cause congestive heart failure. So it can be pretty serious.
I just remember watching a show about it, and I think you would know if you got it because you get really sick.
Yeah. Well, some people do.
Oh.
I think it's not everybody. That's the scary part. So then you can all of a sudden be like, what's wrong with me? And then you're like, well, your heart's about to fail. You're dead. So today, the only approved use of arsenic in any form is to treat relapsed acute promyelocytic? I don't know, leukemia, a certain type of leukemia. But I know at some point people were just tossing arsenic and everything, just, you get arsenic, you get arsenic.
You get arsenic.
Here we go again.
They were putting it in their tea, they were putting it in their food, they were taking baths with it.
Yeah.
It was just...
I think the Bumbles talked about this. I think that's where I was hearing about all the arsenic. Okay, so let's move on to some truly shitty ones, okay? These are some real shitty ones, okay? Here we go.
Real shit here. Oh, I swore.
Okay. So, in apartheid era South Africa, homosexuality was not looked upon fondly, especially in the military. Holy manoli, can I start talking right? Can I start talking right, please? So horrifyingly enough, using army psychiatrists and military chaplains who were presumably privy to private and quote-unquote confidential confessions, the apartheid regime flushed out homosexuals in the armed forces. They would send these homosexual quote-unquote undesirables to a military hospital in Pretoria named Ward 22, where the men would be forced to undergo sexual reassignment surgery and were then cast out into the world, often with their gender reassignment incomplete and without the means to pay for the hormones they needed to maintain their new sexual identities. Which is absolutely horrifying that because somebody is gay, that means that you decide that they want to be the opposite sex and force that on them.
Okay.
What?
So essentially you were having gender reassignment surgery whether you liked it or not?
It was, you were forced to have it. And then it was incomplete and you were just sent out into the world. I mean, I can't even imagine, like, without hormone therapy or whatever else is needed to undergo that transformation. So the head of the project was a man named Aubrey Levin, who later became the clinical professor at the University of Calgary until 2010, when his license was suspended for making sexual advances on a male student. Holy shit! Because, I mean, what a self-loathing piece of garbage this guy was. So he's the one that forced these men in the army in Africa to undergo sexual reassignment surgery because they were homosexuals, and he himself is gay. So he was later sentenced to 5 years in prison for assaults against other males. So obviously this guy's like the biggest piece of trash that's ever lived. One of them.
Okay, I'm no expert here, but I can't imagine it wasn't like, okay, we're going to turn your penis into, a working vagina.
Exactly, a work of art.
Did they just hack it off?
I don't know, dude. It said it was very...
I don't want to know.
It's like, it's taking place at a military hospital, which, I mean, I feel like just from knowing about, not to trash the VA or anything, but hearing enough stories about the VA from people who have been in the military or are in the military, and how it's not the greatest care in the world.
No.
And so it's not like this is a specialty hospital for gender reassignment surgery. This is just a military hospital in South Africa.
Right.
So it's probably not a great reassignment surgery. That's probably not a prize-winning vagina that they're getting out of the mix. I'm
not going to say anything. So I'm just going to insert my foot in my mouth if I do. So
Aubrey Levin, everyone. Let's remember this loser's name, and we can. I'm sure he's still alive. In 5 years in prison, he's probably already out of prison by now. He's probably working as a clinical professor somewhere else, because apparently, 90% of the doctors in the world are just garbage humans. No offense to anybody out there. Okay, so here's some more. During the Cold War, the U.S. and the Soviet Union spent a lot of time attempting to find out if they could survive a nuclear catastrophe. So it is not surprising that the government's go-to choice for unwitting experimentation for this was black citizens. So from 1960 to 1971, Dr. Eugene Sanger, a radiologist, here's another great doctor, at the University of Cincinnati, led an experiment on 88 cancer patients who were all poor, mostly black, exposing them to full-body radiation, even though this type of treatment had been discredited for treating the type of cancer that the patients had. They signed no consent forms. They had no idea the Pentagon was running the study, and they were only told that they were there to receive treatment that may help them. It's the most vague and terrible thing ever. It's a little bit like
MK Ultra, where people would come in wanting treatment for something they're experiencing, and surprise, LSD.
Right. Yeah, surprise, you get full body radiation that has no basis in treating your cancer. There's no basis for that to be used.
In the 60s, they were using radiation to treat acne in teens.
Oh, cool.
So,
oh my gosh.
As if acne is not the most awful thing to go through in your 30s.
Yeah. Mm-hmm.
It's just, let's just inject your face with some radiation and
hell.
Hopefully this helps.
I thought Accutane was bad whenever I was a kid.
Oh.
I mean, I stopped it early.
You had to take it?
Mm-hmm.
I'm thankful I never got on it, but some people say it was the miracle that saved their skin and they haven't had issues since. But I remember my mom's boyfriend's son had to get on it, and his face got so much worse before it got better.
Oh, yeah.
To the point where, he couldn't even go outside because the sun and it was so dry and cracked.
You're so sensitive to the sun. I had to go, I was 15, I think, 15 or 16, I was a virgin. I was like, I swear I'm a virgin. They made me come in every month to take blood so they could see if I was pregnant because of the fetal damage that it caused.
What?
Yes, and I was like, I'm not pregnant, but they made me come in. They also needed to check my blood, my levels, because it messes you up so badly. They gave me a list of foods I had to stop eating while I was on it because my blood pressure was high. And
oh my God.
And honestly, I felt mentally unstable. I felt like I was gonna explode out of my skin sometimes. It was so
really
weird. Yeah, it was terrible. And I just stopped it. I had big patches of skin that were so dry that even if I got a tan, it wouldn't tan those patches. It was horrible.
It's crazy.
Yeah, it was terrible. Anyway. So we're back to these cancer patients that were being tested on by Dr. Eugene Sanger. In 1 hour, they were exposed to the equivalent of 20,000 x-rays worth of radiation, and obviously from that experienced mental confusion, stomach pain, nausea, vomiting, all sorts of terrible side effects. A report in 1972 showed that a quarter of the patients that he treated in this study died from radiation poisoning. And
no way.
Yeah, right. And this piece of shit doctor just recently received a gold medal for career achievements from the Radiological Society of North America, if you can believe it. I can, honestly, because our society is like that. I'm like, this is it. It doesn't matter the cost. If you figure out, see, that's the thing. And it's really hard because it's like, okay, in some vein, I do understand that what you got out of this, maybe it has gone on to help way more people, perhaps. And I understand that that's their justification here, is that it's same thing with all the Nazi shit that they did, which I'm not even talking about any of those today because that's a whole episode on its own. But a lot of medical advancements that have been put into use today were yielded from those tests. So to some people, they might say, well, it was worth it to do that.
But where do you draw that line?
Well, I just don't think I don't know. Is
there a line
it's
to
really
be drawn?
Hard. It's super unethical for sure to do that.
It is.
It's terrible. You are a monster. For sure, you're a monster. But is there some part of us that, as a society, that we need a monster? That's a kind of a question it's terrible. You shouldn't. When it comes down to it, no. But at the same time, it's shit. How can I can see the other side, even though it's horrible, heinous, terrible. It is a monster. Okay. So let's talk about another monster. The man that's considered the father of modern gynecology. His name is J. Marion Sims, and he conducted numerous experiments on female slaves between 1845 and 1849. These women that were afflicted with a vesico-vaginal vistulus, a tear between the vagina and the bladder, they suffered greatly from the condition, were incontinent, and it resulted in societal ostracism. He thought the surgery that they needed to try and fix this was not painful enough to justify the trouble of using anesthesia. And so there were all these women who got this extremely painful surgery, up to 30 operations sometimes, all without anesthesia because he was like, they're good, which is truly horrifying. Many of the women died from these operations. And obviously, it was, you're performing the most painful operation possible without any anesthesia. In order to test one of his theories about the causes of trismus in infants, he performed experiments where he used a shoemaker's awl to move around the skull bones of the babies of enslaved women. It has been claimed that he addicted the women in his surgical experiments to morphine, only providing the drugs after the surgery was complete in order to make them more compliant in the future. So he was a piece of garbage. There's also people that say he did stuff that was worth it. Anesthesia wasn't proven to be something that was effective and safe back then. But I think that the overall consensus is that this guy was a dirtbag.
Yeah.
There's the Tuskegee syphilis experiment in Tuskegee, Alabama. Between 1932 and 1972, the U.S. Public Health Service experimented on 399 impoverished black males who had syphilis. They were offered treatment by the researchers who did not tell the subjects that they had syphilis and did not give them treatment for the disease, even though there was one at the time. And instead, they just studied them to chart the progress of the disease. So penicillin was available as a treatment, but the people running the study prevented the participants from receiving treatment elsewhere and lied to them about their true condition so that they could observe the effects of the syphilis on the human body. By the end of the study in 1972, only 74 of the subjects were alive out of 399 men.
Wow.
28 of the original had died from syphilis. 100 were dead from related complications from syphilis. 40 of their wives had been infected, and 19 of their children were born with congenital syphilis. The study was not shut down until 1972, when its existence was leaked to the press, forcing the researchers to stop in the face of a public outcry. We also, in Guatemala, did this exact same thing to people. The U.S. has. So, cool.
Speaking of syphilis, I don't know.
Yes.
At one point, doctors believed that fevers would cure syphilis. So they were actually injecting their patients with malaria.
Oh, yeah. I had that somewhere.
To help cure it. And if you don't know, malaria is caused by a type of microscopic parasite that gets down into your liver and then into your bloodstream.
Yeah.
And it's passed on to humans through an infected mosquito. And I mean, you can survive it, but you have fever, chills, headache, nausea, vomiting, muscle pain, and fatigue. And overall, just probably a miserable existence. Yeah. And the parasites can lie dormant for a year. So you can have it and not. So, I mean, if you suddenly get sick, you can't really pinpoint malaria off the bat. So
I know that I read that the fever actually did kill off the syphilis, I guess, because the temperature was too hot for it to survive. Yeah. But, yeah, so...
Probably not the best way to go.
Probably not. Okay, one more before lobotomy. In 1963, there were 22 elderly patients at the Jewish Chronic Disease Hospital in Brooklyn, New York, that were injected with live cancer cells by a man named Chester M. Southam, who had done the same thing in 1952 to prisoners at the Ohio State Prison, which sounds like it may have been, that might have been for MKUltra. So in order to discover the secret of how healthy bodies fight the invasion of malignant cells, the administration of the hospital attempted to cover up the study, but the New York Medical Licensing Board ultimately placed Southam on probation for 1 year. But 2 years later, the American Cancer Society elected him as their vice president. So it's kind of just like all these doctors that do all this really insidious stuff. And I know it's all in the name of medical progress or whatever, and then they're just freaking awarded and rewarded for doing it. Okay, so we're going to get to the meat of this episode, even though it's already long as hell. So in the early 20th century, the number of patients entering mental hospitals grew exponentially, though there was little available in the way of safe and effective treatment, which is like kind of like, oh, what's new in that regard.
Right.
It was during this time that a rather nihilistic and demoralized psychiatric community began experimenting with more quote-unquote heroic types of therapy, which in the medical community are described as treatments which pose a high risk of causing more damage to the patient's health, but are performed as a kind of last-ditch effort. Some of these types of therapies included malarial therapy, which, like Shai just talked about, is where you infect a syphilis patient with malaria to let them go through about 3 to 4 bouts of the flu to kill off the Sensei syphilis bacteria. There's deep sleep therapy, where a drug is used to keep a patient unconscious for days or weeks, which is essentially the under-equipped mental health facility version of Casey Anthony, like Zanny the nannying her daughter to sleep every day. There was insulin shock therapy, where patients were repeatedly dosed with large amounts of insulin that would produce a coma-like state on a daily basis, which would be repeated for weeks. This is all sounding very MKUltra to me. So obviously, here's another one: electroconvulsive therapy, formerly electroshock therapy, in which seizures are electrically induced in patients to provide relief from mental disorders. And the success of these shock therapies essentially paved the way for more invasive treatments like lobotomies, which is what we are now going to talk about. So, big time weird stuff here. So neurosurgery or neurological surgery is the medical specialty concerned with the prevention, diagnosis, surgical treatment and rehabilitation of disorders which affect any portion of the nervous system, including the brain, spinal cord, peripheral nerves, and extracranial cerebrovascular system. So psychosurgery is the neurological treatment of mental disorders. And it has been a controversial field of medicine since its modern inception under Swiss psychiatrist Gottlieb Burckhardt in the 1880s. At this time, his experimental surgical procedures were widely condemned, and it would be another few decades before psychosurgery would begin to be more widely practiced. The first significant psychosurgical pursuit in the 20th century was by Portuguese neurologist Antonio Egas Moniz, who developed a procedure he called the Loboto-me, which he claimed treated mental illness. It involves severing a patient's connections in their brain's prefrontal cortex, in which most of the connections to and from the prefrontal cortex, the anterior part of the frontal lobes of the brain, are severed. And this went on despite the fact that it was very frequently leading to serious side effects.
No.
You don't say. While there were occasionally patients who got symptomatic relief from the procedure, it would come at a cost in which it created other impairments. Duh. Like, you won't be gay anymore, but you can't move the left side of your body, you know?
Right.
So,
yeah.
Fair trade,
well,
I guess.
One psychiatrist described it as putting a needle in the brain and stirring the works.
Oh, that sounds nice.
It's just lovely.
And as we kind of mentioned earlier, you know, mental health is still something that is not very widely understood. Or
right.
Back then, it was like, you're gay, that meant you have a mental health issue.
Or you were possessed.
Or possessed or something, you know, ridiculous.
Yeah.
If you're a woman and you're just
depressed,
go in and get fingered by the doctor.
Yep.
Or we'll stir your brains up and see how it works out for you.
Speaking of like depression and stuff, so in the 1960s, it was actually popular for parents to get their moody teenagers lobotomies.
Oh, jeez. Yeah, just...
Which, yeah.
Pay no heed to all those crazy hormones. Just stir your brain up.
Yeah.
So Antonio Egas Moniz shared the Nobel Prize for Physiology or Medicine in 1949 for the discovery of the therapeutic value of the Loboto-me in certain psychoses. If you can believe that, which we all can, I know. Although the awarding of the prize to him has been subject of controversy, he still got it, even though he's dead.
Yeah, he had claimed that it significantly improved the first 20 patients that he had. And okay, but what is improvement? Because what they wanted to do was they had these mental patients in these institutions, right? And they were very hyperactive. They were hard to control. They were loud. They were, they had something mentally wrong with them. So they claimed that the lobotomy would make them more docile, and that was a better life than having to live their life in a straitjacket in a padded room. So being an invalid is better,
right,
than having movement and motor skills.
Well, it's better for them because they're just like jamming the mental hospitals up with people and not having enough people, manpower, or money or anything to give them actual treatment. The first Loboto-me performed in the U.S. was in 1936 by neuropsychiatrist Walter Freeman, and he's a real piece of garbage himself.
Yeah.
And his colleague was kind of a garbage, but he was a little bit better. He started to distance himself from him, but neurosurgeon James W. Watts.
I just read my notes. I said he was DTL down to lobotomy.
He definitely was.
I'm an idiot.
Trying to give out lobotomies to everybody. So Freeman spent years tirelessly researching to find a neuropathological basis for insanity, which was ultimately fruitless. And in 1937, he and Watts adapted Moniz's procedure with the Freeman-Watts standard prefrontal lobotomy, what they called the precision method. And this method still required drilling holes in the scalp, so surgery had to be performed in a appropriate surgical room and by trained neurosurgeons. So he claimed that he was super concerned with the procedure because he didn't think it would be available to the people who needed it most, which were those that were in state mental hospitals with no operating room, surgeons, or anesthesia, and were operating on little to no budget. Now, I don't think it was just his desire to bring this procedure to the underprivileged as much as he just wanted to be able to do it willy-nilly like a madman.
Yeah.
But he wanted to simplify the procedure so that it could be carried out by psychiatrists in psychiatric hospitals without...
Like a surgical...
They wouldn't need anesthesia or an operating room. So in a truly horrifying turn, he began conceiving of an approach... This is it right here, where he accessed the he accessed the frontal lobe through the eye socket versus having to drill holes in the head. And in 1945, he took an actual ice pick from his own kitchen and began to experiment on cadavers with this technique, which he called the transorbital lobotomy, which involved pulling up the upper eyelid and inserting the point of a sharp instrument in the corner of the eye, under the eyelid, and against the top of the eye socket. Then, and I'm telling you right now, brace yourselves, everyone, hold on to your butts, because a mallet was then used to drive the orbitoclast, which I guess you would call the sharp instrument, through the bone into the brain along the plane of the bridge of the nose. They hammered it in there 2 inches into the frontal lobe, which is, if you do out 2 inches with your fingers, I mean, that is quite a distance. You know what I mean? That's it. So, yuck.
Yeah.
And to be very professional about it. Oh, and then after you hammer it in 2 inches, you pivot it 40 degrees so the tip cut toward the opposite side toward the nose, and then it was returned to the neutral position and inserted another 2 centimeters into the brain before being pivoted around 258 degrees. That can't be right. It's some amount of degrees each side to cut outward and then inward. So you're just stirring it up.
Well, because they're wanting to sweep. Yeah. You know what I mean?
The stirring it up is probably the most accurate description. You're hammering it in 2 inches, and then you're stirring it up. I mean, because you're trying to sever the connections.
So yeah,
that are there. Well, there's in an even more radical variation at the end of the last cut that I just described. The butt of that sharp instrument was forced upwards so that the tool cut vertically down the sides of the cortex of the interhemispherical fissure. The deep frontal cut is what they called it. All the cuts were designed to transect the white fibrous matter connecting the cortical tissue of the prefrontal cortex to the thalamus. And the tool was then withdrawn and the tool was then withdrawn and the procedure was repeated on the other side.
And this was all done not under anesthesia, right? Like he preferred to immobilize his patients.
Yes. It's freaking horrifying. And he wanted to do this in places that didn't have a operating room. They could just go in at like the office where they get therapy.
Oh yeah. One lobotomist, another one, Wiley McKissock, Sir Wiley McKissock. What a stupid name.
Kiss my cock. Whatever his name
is. He was another prolific lobotomist, and he was thought to have performed over 300 of these procedures. And he thought it was just like the miracle cure, what modern science and medicine always needed in their life. He was described as someone that would just take a drive on a Saturday to people's houses, whatever hospital, and performed 3 to 4 lobotomies and just be on his way.
Cool.
And one patient was described as being cured of her fear of fire because after she went and had her lobotomy, she went down to the local fish and chip shop and ordered fish and chips that had hot oil on them. And so it meant that she was cured of her fear of fire.
Oh, good Lord.
I'm like, maybe she was just hungry.
Yeah, that's probably it. Walter Freeman, he performed as many as 4,000 of these lobotomy procedures, despite the fact that he had no formal surgical training. So he just taught himself on cadavers and then went off and performed over 4,000 of these on actual living human beings. So up to 40% of his patients were gay individuals subjected to a lobotomy in an attempt to change their homosexual orientation, leaving most of these perfectly healthy individuals severely disabled for the rest of their life. A lady named with the last name Mortensen was a long-term patient and was receiving her third lobotomy from Freeman when she died of a cerebral hemorrhage, as did many as 100 of his other patients. He was later banned from performing this procedure, but he, did damage to a bajillion, almost, a lot of people, thousands of people.
Yeah.
His patients often had to be retaught how to eat and use the bathroom. Relapses were common, some never recovered, and about 15% of them died from the procedure itself. In 1951, one patient at Iowa's Cherokee Mental Health Institute died when Freeman suddenly stopped for a photo during the procedure and the surgical instrument accidentally penetrated too far into the patient's brain. He wore neither gloves nor a mask during these procedures and was extremely unsanitary. He had no training doing surgery or performing surgery, so, what did they expect? And he lobotomized 19 minors, including a 4-year-old child, which I can only imagine, what in the hell for. Use of the procedure increased dramatically between 1940 and 1950, with over 20,000 being performed by 1951. That was a number that was proportionally more in the UK, actually.
Which is insane.
Yeah, so what will come as a big shocker for everyone, I know, is that the majority of lobotomies were performed on women, as you mentioned earlier.
Actually, Rosemary Kennedy, JFK's sister, she had one in 1941, and it left her incapacitated and institutionalized for the rest of her life.
Yeah, and it was publicized, but it still continued on.
Yep.
In 1951, there was a study of American hospitals that found that about 60% of them were women that had gotten these lobotomies, and in Canada at the time the numbers were around 74%. So women were just getting them left and right for just probably any old reason, My wife wants to have too much sex, stir her brains up, please. What the world?
My wife thinks I should help clean the house.
Stir those brains.
Get her a lobotomy.
Luckily, at some point in the early 1950s, lobotomies began to be abandoned.
Thank God.
There was a man named Roy Porter. He says that the often violent and invasive psychiatric interventions developed during the 1930s and 40s are indicative of both the well-intentioned desire of psychiatrists to find some medical means of alleviating the suffering of the vast number of patients then in psychiatric hospitals, and also the relative lack of social power of those same patients to resist the increasingly radical and even reckless interventions of asylum doctors. Well, yeah, like we said, a lot throughout history, a lot of the time, it's the disadvantaged people without any power that become the kind of experimentees to these doctors and, people trying to supposedly find new ways to help the masses at the cost of just taking advantage and killing random innocent people.
Well, like we've said before, a lot of these experimentations, sex workers are often a target. People that are impoverished are often a target. And in the 50s too, was it the 50s or 30s? I think it was the 50s, where women were described as being extremely depressed and unfulfilled in their life. So they're being prescribed things like Vicodin just left and right.
Mm-hmm.
So it would make sense for them to target. I wouldn't say they targeted women, but I don't think they offered the care. And I just kind of figure it's like, oh, you should be thankful that you're a housewife and a kept woman, and why are you depressed? And there must be something wrong with your brain.
There's no way
Susan.
that sitting around twiddling your thumbs at home all day and making food for everybody isn't the most fulfilling job in the world. No way.
Yeah.
Yeah. Well, it's just, they don't have the power. It's minority. They try women, children, people with mental health issues, people who are poor, whoever doesn't have enough power to stop you from doing it to them.
Yeah.
Really. So in modern day, there is something still being used called the synuglottomy, that it's used to treat people with obsessive compulsive disorder, and it's where doctors destroy a small amount of brain tissue thought to be overactive. So it's somewhat similar, but it's not just used for, they're not just, I don't think they're just going in and stirring your brains up because
with an ice pick.
Yeah, because you wanted to wear 2 different colors and sing in the street or something.
Well, the prefrontal cortex, the part where they stirred, it's the part of the brain that controls your will to live, your personality, planning, cognitive behavior, social decisions, and just kind of social and, decision-making behavior. So,
yeah,
like a lot of times, like patients would end up being extremely lethargic, just piles of pud. They were just like unseasoned mashed potatoes, essentially.
Yeah. Obviously, we need the medical community to help humans cure diseases and save lives. And that's a great deal of what they contribute to society. But it's difficult to ignore the horrors that have been committed in the name of advancements in medicine. As we heard from MK-Ultra, as we know about the people that were experimented on during World War II, and the myriad of other instances where cruel and unusual experiments and treatments were carried out against disadvantaged people. I still am left with kind of like, I don't like going to the doctor anyway, but it's not made me want to just all of a sudden jump on the doctor train. I'll tell you that much.
Not at all.
No. Leave me out of it. I don't want to see any of you. So, kind of, definitely creepy, I would say. I think we can all agree.
Some popular movies that reference lobotomies are based around lobotomies. My personal favorite, which like nobody else likes, so maybe I'm a loser, but I thought Sucker Punch it's one of my favorite movies, and I don't know if you've seen it.
Heck, I don't know if I have.
It's got that really pretty Emily Browning. She's like kidnapped, or no, she's not kidnapped. She's put into this weird orphanage by her stepdad after he kills her mom, and it's like this huge brothel ran by this guy. And it's directed by Zack Snyder, if that tells you anything. So I didn't think a lot of people liked the comic booky feel to it, but I loved it. So anyway,
I don't think I saw that one, but I do love Oscar Isaac, who's on that movie.
Yes, I love him.
Yeah.
A Clockwork Orange, which I've never read, and I watched part of, and I thought it was really stupid, and I'm sorry. A lot of people think it's like so great, and I don't know if they do a lobotomy or just like reprogramming, but same idea. A troubled person taken in and having their brain messed with. Disturbing Behavior with Katie Holmes before she married Tom Cruise, and she was very cute. I like that movie a lot. And
I don't remember that one either.
Oh my gosh! I think it's on Amazon Prime. Okay. And then of course One Flew Over the Cuckoo's Nest with Jack Nicholson.
Oh yeah, which is a flippin' classic. But also will destroy your soul. Truly.
Yeah.
It's one of those movies where I like own that movie, but I'm like, I'll never watch that movie because will I ever be in the mood to have just my entire life crushed?
We watched it in my English class my freshman year because my teacher loved to do. I think she was lazy or just the coolest teacher. we watched so many movies because she liked to talk about symbolism in movies and
maybe
hidden meanings and stuff. So it was fun. Like we watched a Penny Marshall film, Awakenings, with Robin Williams, I believe.
I don't know that one.
Oh, I could be wrong. But anyway.
Well, don't go to the doctor, anybody. They're all out to get you.
Yep. You just gotta
stay away.
Just sweat it out. You'll be fine. If you feel sick, you probably just have to poop. So.
But I also am joking because I know some of you out there have some serious illnesses and whatnot that do require the care of a doctor. So I'm not trying to make you freaked out, but it is just a definite. It's one of those things where I truly don't really know how I feel about it because I do understand both sides of the
spectrum
coin, but
story.
Man, that just seems wrong to me. Big time wrong.
Oh yeah. So thankfully we have come far away from that. I think
mostly.
Oh, but we still have so much improvement to make on the mental health scene.
Yeah.
Like
big time.
It's almost disgusting that how much progress we haven't made.
Yeah, for sure. Yeah. It's just because it's not a priority, to any of the powerful individuals. Because,
right.
It probably puts us at a disadvantage, and they need us to be at a disadvantage.
Yeah.
I don't know. Okay, I won't go.
That's another conspiracy theory.
I won't go off onto tangents, but anyway, thanks for listening, everybody. It was good to be back.
We're just ramping up to some more serial stuff. Serious.
Cereal.
Like serious. No.
Oh, if you're listening to this point, that has to mean that you're at least enjoying us somewhat, and if that's the case, please go and give us a 5-star rating on iTunes, and if you feel so inclined, a written delightful review. For every really 10 or so that we get one terrible one that crushes my soul. So just do it to make us happy. Yeah. And we appreciate it so much. Okay, Twitter, Creep It Real Pod, Instagram, Creep It Real Pod, Facebook, Creep It Real. You can join the Creep It Real podcast hangout. Yeah, do all that stuff. And
post all your funny memes on there.
Yeah. Come join us on social medias.
Join us. Yep.
We'll start brainwashing you soon.
and give you lobotomies.
No lobotomies.
Oh, dang it. Okay.
No lobotomies allowed here.
Arr.
Okay. We're an anti-lobotomy crew.
The anti-lobotomy crew.
Yeah. Okay.
Cool.
All right. Well, it was good.
Right.
It was good. I'll see you next time.
Bye.